Lovely to meet you, Dr. Apurba. How are you doing today?
Yeah, I'm doing fine. Thank you, ma'am.
Thank you. Thank you so much for joining us today. I think what our audience is really wondering, a doctor like yourself, tell them a little bit more about your background and tell them also what got you so inspired about exploring the health and wellness domain for yourself as a professional.
Okay. To give some intro background about myself, I am a medical doctor with training in industrial health, safety, and human resources. So I've been working in the corporate sector for last 20 years, and through my journey in healthcare, I realized that healthcare not only the clinical side, there is much more deeper into that. And for dwelling into the deeper, we need to understand really the mindset and the requirements of the patients, or let's say our clients. So what I am looking at is not from a health point of view. I am looking it as a from a wellness point of view. And when I went further, I realized that if I need to do things right, I need to listen to my
Hmm.
clients and
Hmm.
go into the basics, root cause, rather than the superficial symptoms or the problems. So that got me, going, and made my mind inclined towards, health and wellness. And I thought, why not get a formal qualification so that my concepts are also cleared, and I have the practical skills also to implement this.
Thank you so much for sharing that because you definitely hit the nail on the head. There is a huge gap sometimes between the doctor and the patient, right? Because the patient today or the client in itself is looking for something that is wholesome, that is holistic, that will help them to take accountability for their health, that will help them to take, actionable steps towards the life and the health they want to create. And you really identified, because you've had such a long tenure in this industry, you identified this gap, and hence you came in and you decided, let me explore this a little bit more. So tell me, you decided to do the course, with us. And what were one of the things that you said, I understood that I have to, as a doctor, I have to listen more. There's power in listening. Besides that, what are the other core skills that you think that you learned from the program that you find it very beneficial now in your practice?
Yes. So when I embarked on my journey,
Yeah.
I searched for something which could suit me and enable me to enhance my skills. So I came across this WellG program, and first of all, I think I should congratulate WellG for designing and delivering such a beautiful and structured program. It
Thank
helped
you.
me train to become an effective coach and enable me to help others achieve and maintain a healthier and balanced lifestyle. So thank you, Velji. I think in my entire career, I have done plenty of courses, uh, many certifications, and it was one of the well-designed, structured program that I have encountered. So apart from that, why and how of the journey or and the program. So in today's world, the health and wellness services are very essential because uh, non-communicable diseases are rising very fast, and post-COVID, mental health has also gained much limelight. Though it was there, the problem was there, but the society were not realizing. They were only seeing the tip of the iceberg. But right now, they have learned that mental illness is far prevalent in the society. And as a clinician, majority of us, our cohort group or peers, focus on the physical health only, and they just deal with the somatic symptoms and all. But what we realize when we listen or when we discuss with the patient, that the problem lies elsewhere, and majority it is due to either mental health issues or their lifestyles or due to their emotional and social background or problems. So the program, or even if someone who is not in this program but is inclined toward this sector or this segment of wellness, health and wellness, so they must have this holistic view in mind so that they can deliver the best of their services to their clients.
Thank you so much. So beautifully said, right? We as individuals are beautiful and are complex. There are many aspects to our lives. And in a conventional approach, we sometimes just look at one area of their life and not the entire area. And the idea is to how can we learn skills and tools that will allow us to delve deeper into the client's life. In fact, help the client to dive deeper into their own self, identify their strengths, their values, their beliefs, and help them to overcome obstacles. So I think with this beautiful program, this entire bridge, the missing link in the healthcare system can actually be fixed.